Spring is in the air, and so are my travel plans. And I'm so excited that I'm going to Paris with one of my very best friends. And because of that trip, I've officially entered my elevated travel essentials only era, which is why I'm packing Quince. Quince makes luxury feel effortless and affordable with travel-friendly staples that look amazing and don't break the bank. Right now, I'm loving their 100% European linen pants. They're lightweight, super comfy, and somehow go with everything. Exactly what I need for wandering cobblestone streets and sitting at a cafe, having a cup of coffee. And I'm also eyeing their featherweight cashmere scarf. It looks perfect for staying cozy on the plane and layering up for those cool Paris evenings. Quince has it all: premium luggage, elevated basics like washable silk and linen from just $30, and beautiful bags to carry it all. And get this, their prices are up to 80% less than similar brands. Quince works directly with ethical factories and skips the middleman, so we get the luxury without the markup. For your next trip, treat yourself to the luxe upgrades you deserve from Quince. Go to quince.com/nursemo for 365-day returns plus free shipping on your order. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. Well, it's Monday again, so you know what that means. It is time for Mo's Monday Minute, my quick, short episodes that feature actionable tips or advice that you can incorporate right away. And for this week, I want to talk about this concept of when you're assessing a child, how to maybe kind of quickly determine if the child is big sick or little sick. And that's a term that I learned from my paramedic husband. First thing he wants to know when he looks at a patient is, are they big sick or little sick? And this is really, really crucial in children because they can decompensate so very quickly. So one key way to kind of clue in if a child is very ill or big sick is to observe their level of activity and how responsive they are to their environment. You might have seen this if you've taken a pediatric advanced life support class. In the videos they show of the children in respiratory distress, it's very clear that the child is not engaging with the environment, engaging with the nurse, has lower levels of activity. This child is in trouble. So a seriously ill child or a child who's in distress is going to be listless, not moving around or not moving very much, or very almost just like you move them and they just kind of flop back down, right? They're not moving much. They're listless. The decreased activity overall, and again, not be curious or engaged with their environment. They may not even protest when you do something that would normally annoy the heck out of them, like taking a blood pressure. And I can tell you, children hate having their blood pressure taken. So if you're assessing a child who's potentially falling into that bigger sick category and you go to take their blood pressure and they just let you do it, I'd be getting pretty darn concerned. You want to get extra help in there fast because this child could decompensate very quickly. So that is my quick tip for you today. If you're assessing children, especially younger children who can't really communicate with you and tell you what's going on, that is one way to help determine if they are seriously in trouble or, just maybe have a small problem that could be easily fixed. I hope this helps you, and I hope these quick little short episodes help you overall. Just improve your practice, whether you're a nurse at the bedside or a nursing student on your journey to get your license. I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Americans love using their credit cards, the most secure and hassle-free way to pay. But D.C. politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com.